Hello, my name is Dr. Robert Henry. I'm the Chief of Dental Services at the VA Medical Center in Lexington, Kentucky, and an Associate Professor at the College of Dentistry at the University of Kentucky. Brushing your teeth is important, not just to keep your mouth healthy, but to keep your whole body healthy. Good oral care is especially important in nursing home residents. A dirty mouth can make frail elders very sick. When teeth aren't brushed, plaque and bacteria collect around the teeth, causing gum disease. Gums become infected, swollen, and bleed easily. A person who has gum disease has an infected wound in the mouth. The surface area of the infected gums is about the size of the palm of the hand. The bacteria from gum disease get into the bloodstream and may cause serious health problems. Studies have shown that people who have gum disease are more likely to have a stroke, complications from diabetes, and pneumonia. Pneumonia is the #1 cause of death in nursing homes. Many cases could be prevented by simply keeping the mouth clean so that the patient breathes in fewer germs. 15 different studies have shown that brushing the teeth lowers the risk of pneumonia in nursing home residents. Here are the guidelines for providing excellent daily oral care for nursing home residents. Before providing oral care for any resident, check with the charge nurse to see if there are any residents who should not receive oral care that day, or if the oral hygiene routine needs to be changed for any resident. For example, mouthwash, toothpaste, and water should not be given to a resident who is comatose, who is care resistant, who has dietary restrictions prohibiting thin liquids, who has swallowing problems, or who can't or won't spit. For patients who cannot have mouthwash, water, or toothpaste, you may simply moisten a toothbrush with an antiseptic mouthwash and brush teeth as usual. After checking for any special precautions with the charge nurse, review the resident's individualized oral hygiene plan for specific instructions. These instructions may be on the care plan. The oral hygiene plan should contain the following information: whether or not the resident has natural teeth, dentures or partials, whether or not the resident can brush their own teeth, what oral hygiene tools work best, for example, what kind of mouthwash, and any special precautions. An example of a form that could be used to create an individualized oral hygiene plan for each resident is provided for you in the written materials for this program. Now you are ready to set up your supplies near the resident on a clean towel. While you are setting up, greet the patient and explain what you are doing. You will need the following supplies: gloves, mask, safety glasses, soft toothbrush, fluoride toothpaste, 2 clean towels, 2 paper cups, 1 with water, mouthwash, floss or proxy brush, and lip lubricant. All oral hygiene supplies should be labeled with the resident's name in permanent ink. If the resident has dentures, you will also need a denture brush, denture paste, and a denture storage container. A dentist may prescribe chlorhexidine mouthwash for patients with gum disease. This decreases plaque and germs on the teeth. Studies have shown chlorhexidine significantly reduces pneumonia in hospital patients. Chlorhexidine can be used as a mouthwash to swish and spit, or can be used to moisten the toothbrush before brushing the teeth. If a dentist doesn't suggest or prescribe a certain mouthwash, a mouthwash with no alcohol is best. An antibacterial mouthwash would be a good choice for most all patients with or without natural teeth. The most important oral hygiene tool is the toothbrush. Even if you don't have access to toothpaste, mouthwash, or floss, you can still remove plaque by brushing. Moisten the brush with water. Make sure to choose a toothbrush with very soft bristles and a small head. This will be more comfortable and reduce resistance to care. After setting up supplies, position the resident. If possible, the resident should be sitting up. If the resident can't get out of bed, elevate the head of the bed. This may help prevent pneumonia. After positioning the resident, place a towel around the resident's neck. Then wash your hands thoroughly and put on gloves, mask, and safety glasses. Remember, after you have put on gloves, do not touch anything before providing oral care. Touching other things will get germs on your gloves that will go into the resident's mouth and can make them sick. If a resident has any natural teeth, they should be brushed. Place a pea-sized amount of fluoride toothpaste on the toothbrush. Let the resident know that what you're about to do won't hurt them, but will help them be healthier and make their mouth feel clean. When speaking with the resident, remember to maintain eye contact and to avoid baby talk. Ask the resident to open their mouth. The best brushing method focuses on cleaning the gums and the teeth. The tips of the bristles are placed at a 45-degree angle to the gums. The brush is pressed lightly so the bristles spread under and around the gums and teeth. Start on the upper right cheek side of the teeth, then move the brush in small circular or back and forth motions to remove the plaque. Brush the cheek side, inside, and tops of the upper teeth. Move to the bottom teeth. Brush the outside, tops, and inside of the teeth. During oral care, offer praise and encouragement. Smile. Use a gentle touch and give breaks often if needed. Teeth should be brushed for 2 minutes. If a resident is brushing their own teeth and you are helping, make sure you don't rush them. If the resident clenches the teeth, don't force their mouth open. If possible, brush the outside surfaces of the teeth. You may need to try again later when the resident feels better. If the resident's gums bleed during brushing, this is a sign of gum disease. With continued daily brushing, the bleeding should stop. After brushing the teeth, the tongue should be brushed by using a gentle sweeping motion towards the outside of the mouth. When you are doing mouth care, look for problems. Report pain, sores, swellings, discoloration, dry mouth, broken or decayed teeth to the charge nurse or a dentist. After brushing the teeth and tongue, the resident may swish with water and spit back into the cup when done. Next, the resident may swish with mouthwash and spit into a cup. If possible, the teeth should be flossed. A floss holder may be helpful. Pass the floss between the teeth by using a gentle back and forth motion. Wrap the floss in a C shape around the tooth surface. Gently move up and down to clean the side of the tooth. Some residents may prefer proxy brushes to clean between the teeth instead of floss. Make sure to clean and change the brush inserts as directed on the package instructions. If a resident has no natural teeth remaining, the inside of the mouth can be cleaned by using a swab moistened in antibacterial mouthwash. It is still important to brush the tongue since a swab may not effectively clean the tongue. If a resident has dentures or partials, these should be cleaned daily. Place a towel in the sink. Wearing gloves, bring the denture or partial to the sink in a cup. Use a denture brush and denture paste to clean dentures and partials. Scrub the denture on all surfaces and rinse thoroughly. While you are cleaning the denture, look for cracks, broken areas, missing teeth, or sharp areas. If any of these problems are found, put the denture in the storage container and let the charge nurse know. Dentures should be removed at night to allow the mouth to rest. Store dentures in a clean, labeled container. Cover the denture in water and put in a safe place. When oral care is complete, dry the mouth with a clean towel and lubricate the resident's lips. When you are finished, clean up and store the supplies. Rinse the toothbrush well. Dry with the towel and place in a safe, clean area. Toothbrushes should be allowed to air dry. Remove and discard gloves. Wash your hands. Make a note that you have provided mouth care in the care plan. Carefully following these procedures will assure not only better patient oral care, but better overall health for residents of nursing homes and other long-term care facilities.